All right, welcome everybody. This is the first installment of my YouTube channel, Pain Information, paininformation.com. I've done pain information podcasts for a while now, since I guess 15, and I was told YouTube's the place to be. Now, this is my office. I'm not really into a lot of the, I guess, set props, and I'm not into theater. I'm not into anything but original. So what you see is what you get. Today is what I started out with in my original podcast. That's the 5 rules. And I have 5 rules. Pain management. I've done this a long time, over 30 years. I know, it sounds pretty old, sounds pretty dusty, but actually a few pearls are there. So let's go through it. Rule number 1. Pain is a description. It's not an entity. Pain doesn't exist. Pain is a personal experience. Pain is something that is not anecdotal, it's real. Take the fibromyalgia patient, invisible patient. Take the patient with a major injury, real visible pain, all right? And so it's a description. And sometimes a description is the best thing that we have, and sometimes we have to take that description as validity. And why not? Why shouldn't we? Because you can't see, touch, feel, or measure pain, right? You can't do that. And the patient's subjective interpretation of pain is very real. That's what they have, and they're going to tell you about it. Everybody's a little different. I call it the personality pain. It has a lot to do with the limbic system. It has a lot to do with central nervous system processes. And I'm sure I'll get into that. All right, number 2. You got to have a diagnosis. The diagnosis is critically important because you don't know what you have if you don't have a pathway. The pathway takes you to the foundation. The foundation is where you can build your treatment profile and treatment plan. So you have to have a diagnosis. Well, low back pain. I have low back pain. That's not a diagnosis. It's a description. Diagnosis is something like degenerative spinal disease. Well, that results in low back pain. Here we are. Number 3. If you don't believe in your diagnosis, or you don't believe in the disease entity, fibromyalgia, interstitial cystitis, chronic fatigue, headache, those are a few. Irritable bowel. Well, if you don't believe it, you can't treat it effectively, so you got to refer it out. No problem? Okay? Refer it out if you have to. And that's something that healthcare providers have to get over. They have to get over the fact that you can't fix everything. Good pain people know that. Good pain providers absolutely feel that instinctively. Number 4, know thy meds. Know 5 classes of medicines. That's going to be like NSAIDs or anti-inflammatories, opioids, which you know is like hydrocodones, oxycodones, and morphines. It might be gabapentinoids. That's your Lyricas, that's your gabapentins. Also known as Neurontin, which is brand name. Lyrica's a brand name. Okay? So you have those 5, and you ought to have 5 deep on them. You need to have 5 specific drugs that you know in that category. So NSAIDs, it might be naproxen, it might be ibuprofen, whatever. The point is you have to have options, and you can draw on that. And it's up to the healthcare provider to get used to that, to understand that armamentarium, the bag of tricks, and learn 5 more. Each category. Eventually expand those categories. All right? Gotta know your meds. Number 5. If you don't believe in the disease, or you think it's entirely psychosomatic, you can't treat it, right? First of all, I've got to believe in the diagnosis, and I've got to want to treat it. And that's a foundational. But from a compassionate standpoint, rule 5, I really want to help. I really want to help. But from a realistic standpoint, I can't always do that. In other words, don't chase pain. Pain may be here one day, it may be here. So, I really want to help, but don't chase pain. Okay? From a compassionate standpoint, I want to get you all better. From a realistic standpoint, I want to improve your function and quality of life. Basically, that's it. That's the 5 rules. And I'll expand on those and I'll talk about those. You'll pick up the hints of those throughout the series. I'm sure that you'll say, I remember that. He was talking a little bit about that. Or, yeah, I can kind of see what he was talking about. I guess that's the whole point of this is learning what pain is. Pain is one of the most difficult things to treat because, what is it? It is a personal experience. That personal experience is translated into function, quality of life, necessity of meds, of treatments, and movement forward to the best possible outcome, right? We all talk about outcomes, but that's about it. So I'm going to move to number 2 in the series. In the next video, I'm going to talk about one of the rules. I'm going to apply one of the rules to invisible pain.